Hello, I am Dr. Brajraj. Hope you people are doing good. Today I'd like to discuss about one important issue which is very much pertinent, that is called tuberculosis. So I generally encounter many myths about TB. Okay, many people actually frowns after knowing that TB is still happening in this world. Actually, I always say to all those person that TB is happening very much within this world, and India carries the one-fourth burden of the tuberculosis in the world. So, uh, so only difference from the past and present is that TB cases nowadays are declining, it is true, but earlier death, the mortality rate, okay, death due to TB, which is very higher. So nowadays, through applying DOTS, this is diminishing. Okay, so that's the most positive point. Okay, and there are actually two types of TB. One is pulmonary TB, another is the extra pulmonary TB. Pulmonary TB is when TB is happening within your lungs. Okay, and extrapulmonary means TB is happening apart from lungs, maybe some other organs like uterus, bones, meninges, brain, spine, etc. So, how are you going to recognize a suspected case of TB? So there are few symptoms which is constantly advertised through various TV channels, social media, radio, okay, web platform. So first thing, the cough for 14 days or more than that, fever that may come in the evening, generalized weakness, tenderness in the chest region, and loss of appetite, loss of weight. So all those things are very much predominantly related to tuberculosis. So if you encounter any person with having this symptom, so what is the best way to deal with that? So you should refer that patient to the nearest DOT center and encourage him to go for sputum testing. After having sputum testing, as per the result, so we may take a decision whether the DOTS treatment is going to be started or not. And if sputum test result comes negative, but still the patient is suspected, so another few tests could be done like chest x-ray, cbnet, through gene expert machine. So all these things could be done. So I would like to make many more videos on this topic later on, like test and other protocols. Okay, so so I am not going to I am not going in details to describe all those protocol. Okay, so we may do that in the later part. Okay, so once that patient is diagnosed with the TB, the most important thing is that initiating a treatment. So DOTS treatment which is available, and generally for the new cases there are only 4 antibiotics, so through which all those things are now that if you take one tablet, that is sufficient, because fixed dose combination is already in the place. So in a single tablet, so all those compositions are there. So that is very easy to take. Okay, so DOTS treatment is very much standardized treatment, and all drugs which we are using, it is high quality drug with higher level of standardization, and all those are WHO pre-qualified drug. Please always remember. So the government of India is not compromising any amount of any amount to government of India is not actually compromising at all with the standardization. It is actually all these drugs are as per the global standard. Okay, so during my staying at UK and even that other European countries, I always find that that same drugs are available, okay, even in the Western countries. So you should not have any amount of doubt, any quench of doubt, that whether these drugs are going to work or not. So that is the another myth. And third is that many private practitioners and many homeopath and many other doctors, private nursing home, they generally encourage patients, okay, that TB could be treated there. I am not disagreeing that TB could be treated there, but thing is that as per the gazette notification, so all cases should be notified with the government of India, and the best treatment is available within the government of India. Again, I am repeating this fact. So you should be very much confident while accessing DOTS treatment from the government facility, okay. And the lastly I would like to mention that there is another myth that many homeopathy used to say, that by applying homeopathic medication TB could be treated. I never encourage any patients um, to go for homeopathy, because we do not have any amount of huge amount of evidences through which we can may say that we can say that this could be treated through homeopathy or not. And another is that tuberculinum is a different drug altogether. It doesn't have any amount of relationship with tuberculosis. And lastly I must say that if you go through some homeopathic constitution, there is a one constitution is known as tuberculosis constitution, okay. So that is basically one kind of mixed miasm that also doesn't have any relationship with tuberculosis. So please be cautious while taking treatment, or some any people may misguide you. So always trust, have a faith on the government facility. That is my earnest request. And later on what I'd like to do, like this is the first part of the video, and later on the many more videos are going to come up on the tuberculosis and similarly. And I would also like to make many more videos on homeopathic treatment on various diseases, okay, along with that psychological counseling, yoga, meditation. So all these things are going to come up in the future. So please stay tuned to my channel. Please subscribe and like my video if you like that. And I do not have any intention to just to earn money from YouTube. It's not my intention at all. I only have the intention just to spread the positive message about tuberculosis, homeopathy, nutrition, yoga, meditation, and counseling. So all those things are important. World is beautiful. We must enjoy everything in the world. Thank you.